Welcome to today's episode of SPH Behind the Scenes. I'm Tim Beebe. I'm Interim Dean for the School of Public Health here at the University of Minnesota. Today we're going to visit the State Health Access Data Assistance Center, also known as SHADAC. Before we head up, I just want to point out you might recognize this lobby from episode 1 where we visited the Coordinated Center for Biometrics Research. They're housed in the same building here on 2221 University on the East Bank of the University campus, and they're also on the same floor. So what are the odds of that? Let's go head up. So today I'm meeting with Dr. Lynn Blewett, who is the director of SHADAC, as well as a few of her colleagues. So SHADAC has been in business for about 25 years, partnering with states to use and leverage data to provide evidence-based policy making within the health space. Hi Pam.
Hi
Good
Tim.
to see you.
Nice to see you too.
It's been a
Welcome.
long time.
It's been a long time, yes.
It's great to see you. I think
too.
it's probably been 3 or so years.
I think so, yeah.
We're hoping to learn a little bit more about SHADAC, and I want to talk to Lynn first. So
Okay,
can you bring me to her?
I'll take you that way. I'll go this way. All right. I'm just here for you.
Thanks, man.
Okay,
Good
you
to
betcha.
see you.
Have a good day.
Hi, Lynn.
Hi.
How are you? Good to
Welcome.
see you.
Good to see you.
Your office is in a different location.
Yeah, we haven't been here for a
It wasn't
while.
in the corner anymore.
Yeah.
So I brought your beverage of choice.
Thank you.
Dark roast, I think.
Dark roast.
And
Yeah.
you and I have the same thing. It's like we're twins. It's
Yeah.
like looking in the mirror. You know, we're here to learn a little bit more about SHADAC. And so I've known you for a while. I started working here, I think 2001 to 2004. So
Okay.
we've known each other a while.
Yep.
But I want the audience to get to know you and the center a little bit more. So I wondered if you could say a little bit about like what inspired you to start SHADAC.
Well, so when I got my PhD, I went to work for the state of Minnesota, and I was fortunate to have funding from the Robert Wood Johnson Foundation at the state. And so I worked for the state for 6 years and established the health economics program, and I was actually the state health economist. And at the time, states were doing a lot of policy work and reform, and there was just a lot of camaraderie around states around the country. And when I came back to the university, the Robert Wood Johnson Foundation asked me, what do states need, to continue to expand access to coverage. Basically, at that time, we were focused on expansion of, to universal coverage. And Minnesota was along the way to universal coverage. And a few states, about 10 or 12 states, were kind of in a similar position. So what do they need to kind of push this agenda ahead? And so that was the impetus. And I talked to a bunch of states and did kind of a systematic, review around the country and developed a proposal for the Robert Wood Johnson Foundation to look at data and information around health insurance coverage. Because at the time, there wasn't good state level estimates. The federal government produced national estimates and regional estimates, and some of the states, especially the low population states, did not have good estimates. So states were looking for data and information and actually conducting their own household surveys. And so then we stepped in and helped them do that.
SHADAC is one of the centers within the school that has probably more recognition externally than internally. We may not know a whole lot about what you do. Can you say a little bit more about what you do and how examples of what you've done has impacted health policy?
Well, when the Affordable Care Act was introduced, we were part of a stable of consultants around the country to help states implement the Affordable Care Act. And so states were expanding access through the Medicaid program, and we provided, and they were doing enrollment and outreach. And so we provided information on who are the uninsured, where do they live, what are their characteristics, how to reach them. And so it's a combination of survey methodology expertise, which you contributed to when you were here, and then policy analysis, and then we've done some work with Ezra Goldberstein and Jean Abraham to bring in the health economics. So it's kind of a multidisciplinary approach, but leveraging information to inform policy. So I think a key accomplishment is helping states to develop their own infrastructure, but then also to implement sort of access expansions.
The school is known for its commitment to collaboration, engagement, and partnerships. So Who do you partner with in the work that you do?
Yeah, well, we partner around the country with states and with the federal government, but we also do Kathleen Call, who is a colleague of mine and has been instrumental in SHADAC. She does a health insurance survey for the state of Minnesota in collaboration with the Minnesota Department of Health. So we do that every other year. So that's a kind of bread and butter process that we have here at SHADAC to collect information and develop a household survey that collects information. Now we're doing a lot of work on equity and trying to collect more information on race and ethnicity, sexual orientation, to provide more granular data for the state of Minnesota. So we've been doing that survey since you started. We've been involved in that. You're going to meet with Elizabeth. Elizabeth Lukanen. She does a lot of work with the Medicaid and CHIP Access and Payment Commission, MedPAC, or MACPAC, which is the federal organization that does policy around Medicaid. So we have a contract with them. We do a lot of their data analysis and around Medicaid policy, and leveraging survey data and information that we can find around the Medicaid program.
So great, Lynn. You've been able to attract great people, and you have a great team. You mentioned Elizabeth Lukanen. I'd like to talk to her next, if it's okay.
Let's
Can
go.
you show me your office?
Sure.
I'll follow you.
Hey, Elizabeth.
Hi, Elizabeth. How are
Hello.
you?
Good. How are you doing?
Good to
Nice
see you.
to see
Thanks,
you.
Lynn.
Okay, take care.
Welcome.
Thanks. It's
Nice
great to see you.
Nice to see you too.
I don't think I've been here in a few years, and it's
Yeah.
nicely laid out.
It is. It's a great place to work.
So I was talking to Lynn. What we're trying to do here is get a better sense of what SHADAC does, and Lynn has talked a bit about what they do, and I just kind of was wondering if you could say a little bit about your specific role within the center.
Sure. So my title is Deputy Director. So in that role, I work with Lynn and Kathleen and the fellows to think strategically about our research priorities, our funding mix. I've been here for 15 years, so I know a fair amount about our areas of expertise, where we want to grow, and I try to think about, where our staff, faculty, and students, want to inform policy research.
Great.
Yeah.
So Lynn mentioned, and I knew this about you as well, that you do a lot to support state Medicaid programs. Can you say a little bit more about what you do?
Yeah,
in that
absolutely. So in addition to the operational side of my work, I run and manage our technical assistance to states. We're really lucky to have a really generous grant from the Robert Wood Johnson Foundation State Health and Value Strategies program run out of Princeton, which allows us to provide data, analytic, evaluation support to really any state across the country. That often focuses on Medicaid agencies, and most recently, we've been helping agencies transition away from some of the temporary pandemic policies that were put into place. So, for example, the federal government wanted people to maintain coverage during the pandemic, so they asked states to not disenroll anyone from Medicaid. Now that policy has ended.
Yes.
And so suddenly states are having to redetermine eligibility for millions of people. So what we've been doing is helping states think about, developing enrollment projections, so mini modeling, how many people might lose coverage or transition. We've been helping them think about what kind of data they can use to monitor their progress. We've even been helping them do quick turnaround consumer surveys to assess people's experience going through the process. Another area we've been working at a little bit longer term, which I'm really proud of, is we've been helping Medicaid agencies improve their demographic data related to race, ethnicity, language, disability, sexual orientation, and gender identity. And that's really hands-on. It's everything from, probably work you've done in the past about question design and response options, helping them think about how to operationalize it in their system. And what's neat is we're starting to see states that have improved their data now use it to impact health equity in their state, develop programming, do monitoring, and put initiatives in place to reduce disparities.
While I was listening to you, I was paying attention, but I was also trying to do the math. So you said you're 15 years.
Yeah.
I don't think we overlapped, did we? Because Because I left it 2004.
We may have overlapped for a couple of weeks, but what you may not remember, Tim, is you actually were on a panel with me on my very first professional presentation where I got a very hard and fairly rude question, and you came to my defense. And I always remember that.
That doesn't sound like me, but that's good. That's good that you recall it that way. So, well, great. It's great talking to you. The amazing work. The person I want to talk to next is Colin.
Oh,
can you
yeah.
point me to his direction?
Absolutely. I can take you there. Follow me.
Thanks, Elizabeth. I appreciate
Great
it.
to talk to you, Tim. Thank you.
Hi, Colin.
Hi,
Good
nice to see you.
Good to see you.
Have a seat.
Thank you. Thank you. So, thanks for meeting with me. We're trying to get a sense of like what SHADAC does, and it's so diversified. And I know that some of the things that you lead are work in the areas of alcohol and substance use, suicide, as well as adverse childhood events. And can you tell me a little bit about your work in those areas?
Yeah, so those are areas that I think are important in part because they're things that lots of people don't want to talk about, they don't want to think about. But I have a firm belief that if we don't, as a society, think about and tackle these hard problems, then they're going to be issues that fester forever, and that we can't continue to improve and grow as a society. So that's what drives me to work on those kinds of topics.
So how do you do this so that you don't get discouraged and deflated? What do you do to try to make yourself, engaged without a physical, emotional toll on you personally?
Yeah, so that's a really good question. I think that probably most people I talk to would be surprised that I consider myself an optimist, and that I think that all of these research topics that I work on are problems that we can solve. The opioid crisis, adverse childhood experiences, health inequities, these are all problems that, for the most part, people have created, and really only people can fix. But we can only do that if we pay attention to these issues, we draw attention to these issues, we study these issues, and we devise solutions to these issues. So I think that my hope is that my work can play a role in sort of stepping stones toward devising those solutions and enacting those solutions.
SHADAC does a great job in kind of synthesizing information in accessible ways. For the issue briefs are really very powerful. So what do you do at SHADAC that makes you maybe stand apart from others in terms of disseminating the work that you've done?
Before I pivoted to work in public health, I trained and worked in journalism. So I have sort of a theory of change with democratic societies like the United States, that the way you improve policy is by providing strong evidence to policymakers so that they can enact smart policies, by communicating to the public who elect those officials and who petition their elected officials to implement smart, effective policies, and also by partnering with the news media who play critical roles in agenda setting and communicating with those other stakeholders. And that's something that I think that all of my colleagues at SHADAC really prioritize, is looking for ways to communicate with broad audiences beyond just other public health experts, and making sure that we can take our research, take the research of other folks, and make it meaningful for those policymakers, for the American public, for news media, so that they can press for change and devise good evidence-based policies that are going to move public health forward in the U.S.
Well, thanks, Colin. I appreciate the time you spent with me today. The last person I want to talk to is Christina. Would you be able to walk me over to her area?
Sure, let me show you where she is.
Thanks. I'll follow you.
Hi, Christina.
Hello,
Hi, Christina. I hear that you're the best mom ever. Nice. Thanks, Colin. I appreciate it. Good to see you. Good to see you. It's been a while.
Thanks for taking the time.
Well, thanks for meeting with me. I don't know how you want to do this. Should
Comfy? I wanted you to.
Oh, nice. You know, I know that you work a lot working with state and federal agencies to evaluate policies and programs. Can you tell me a little bit about your role in that work?
Sure, my pleasure. It's actually a big part of my job where SHADAC is often working with states to conduct large-scale evaluations, but also we might be just asked to provide our subject matter expertise to help states ready themselves to conduct their own evaluations, usually of health programs or policies in the Medicaid space lately, but in other spaces as well. So it's been a really fun job. I would say in terms of an example of large-scale ones that we've conducted, it's here in the state of Minnesota. The state was expanding innovations in ways to deliver healthcare a little differently to maintain and improve quality and decrease costs, and we were the lead evaluator with a team to look at how they were implementing this work in a formative way and then also what the outcomes were. We also were subcontractor to our sister center, the Rural Health Research Center, on an evaluation that was federally funded of rural health networks in the U.S. So that was fun, where we weren't the lead, but we were a supporting role and got to work with our other center on another evaluation. I would say the smaller scale evaluation work that we do, something recent was a couple of briefs we wrote on best practices in evaluation for state agencies that were doing some innovation in Medicaid to expand services to certain populations, and the federal government has some requirements on how to evaluate that work, and so we helped states think about how to design an RFP to solicit an external evaluator. We help them think about potential measures for their evaluations, data sources for the evaluations, maybe even a comparison group if that was something that was important for their evaluation design. So a lot of different ways to touch evaluation.
Everybody's so busy here. So just tell me a little bit about, what are you working on now that really excites you? What are you most excited about right now?
So I love the evaluation work, but another project that I've been privileged to work on with Lynn Blewett, our director, is called the Medicaid Equity Monitoring Tool Project. So this is an opportunity for us to explore the feasibility of developing a data tool. SHADAC has done other state data tools, but this is a data tool to elevate measures of health equity in the state Medicaid programs. And this is a project that we cannot do alone, so we have some partners that we're engaging to really try and center the experience of Medicaid members and their families in the identification of what's the measure that makes sense for health equity in state Medicaid programs. So we have a few more years of this project, but ultimately we and our partners need to make a recommendation to the funder about whether or not it would be feasible to build, to maintain a tool like an equity tool in Medicaid. So
very interesting, very helpful. I appreciate you taking the time. It's great to see you again.
So good to see you.
Have a great day and keep up the good work.
It's a pleasure.
Take care.
Bye, Tim.
So that was very informative, and we're just kind of scratching the surface. So, really, if you collect strong and defensible data, if you analyze it appropriately and defensively, and synthesize it in a way that's accessible to policymakers and others, you really have a chance of moving the needle on health and healthcare within the state, within the country. SHADAC has been doing that since day one. And with tangible impact. So we're very pleased to have the center within the school, and we consider it one of our jewels. So thank you for joining us today on this episode of SPH Behind the Scenes. I look forward to seeing you in our next episode. Take care.